Hi, Carolyn. Hi.
Yes.
You can look at me or look at the camera.
Oh, yes.
Doesn't
I've
matter.
been a sarcoidosis patient for 10 years. I've been to numerous health clinics. I first started coming to the whole health clinic in April of this year, 2007. And it's been 3 months now, and I've seen tremendous improvement with my autoimmune disorder known as sarcoidosis. I have, first thing I noticed was my complexion change. Everyone commented about my complexion, how it had a glow to it and everything. And then after that, I was on supplements, and I did the dysbiosis therapy. And when I first came to the clinic, my eyes I had 20/70 vision, and everything was blurry. I couldn't read in the print, even with glasses. And I kept doing the dysbiosis therapy and the supplements Dr. Sharif gave me, and now I can read without my glasses. I was farsighted, and I can read, without the glasses. You use reading glasses to see. I can read near and far. I had a lot of darkness in my skin, all over my body, and that's beginning to lighten up. And I can sleep better. I lost approximately 10 pounds. When I first came, I was walking with a cane and walker. Now I can walk without a cane and walker. I had problems sleeping. I could only get about 2 hours sleep at night. I was taking melatonin for that, and that didn't work after a while. I had not really severe night sweats, but it was enough to be bothersome, so they have all disappeared. I have some back pains, not as bad, and some knee pain, but it's only over a period of time I do a lot of activity. It's kind of, over time I get the pain from, I think, too much activity, but it's better. I have more energy in the morning, just wake up refreshed, can fall asleep anytime. My skin has changed, but I have sarcoidosis that is lightening, really light from the top all the way down to the bottom of my legs. It's getting much lighter, and the skin is softening in a lot of areas. I just have my right leg, which was the one that was affected with the left leg, still has some problem when it swells a bit more than the right leg. But the skin is softening there and it's lightening up.
Do you mind putting your legs down next to each other, and I'll focus in on your legs. So, can you, without moving your legs, can you point out where the skin is clearing up?
Around here.
So the top part of the leg is clearing up.
Top part of the leg is getting clear, yeah.
Did the top part look
just like this over time?
Like the lower part?
Yeah, but it's getting back to the regular complexion where my skin is. You can probably see it more on my thighs. You can see where it's fading out, and my skin is coming back to its natural color. My skin used to have a dark undertone to it, but it's coming back to the natural
color.
Yeah.
But the sarcoidosis had severely affected the leg.
Yes.
The legs, the skin on the legs.
Yeah.
And now the top part of the leg below the knee is clearing up.
Yeah, all the way down here. Yeah, you can see.
Yep. And then as far as the right side.
You can see it a bit better there. It's fading out in this area here. You can see where it's fading. It's getting natural.
Right there. That's where it's fading. Right there.
Yeah, natural color in that area.
That looked more like the lower part.
Yeah.
Used to.
Yeah. Like this one there. It's fading. It's coming on down. Even up here from my thighs, fading on down.
What about the left on the right side?
Right side, these light spots are from ulcers, but you can see there too, its skin tone is changing. It's getting more normal, lightening.
Did that used to look more on the lower part too?
Yeah, it was very dark.
Can you not move it just for 1 second? I'm just going to focus in. I'm going to start at from the foot on up. Oh wait, right there, like that. So the part that's clearing up, can you point that out? Right there. That used to look more like the lower part.
Yeah, like this.
Okay, so I'm going to focus on your face again. Thank you. So you can go ahead and keep talking about other improvements, if you would, please.
Well, I'm eating more green vegetables now. I couldn't eat that at first, because I have on Coumadin, and that would affect my Coumadin levels. So the doctor gave me some medication to take for that, and now I'm able to eat green vegetables, which helps my eyes and my systems. And it also helped me keep my digestive system working better also.
How often did you used to have bowel movements prior to seeing me?
Maybe once or twice a month sometime. I mean, it was
Severe constipation.
Severe, really bad. I had to take laxative and stuff. I even used colonics, and that worked for a while and didn't work.
And now, after seeing me, how often are you having bowel movements now?
2 to 3 times a day.
A day. Go on. Any other improvements you can think of?
Well, I lost about 10 pounds altogether.
Mm-hmm.
Now, the diet was the main thing because I had a lot of allergies. And I knew I had allergies. I should eat certain type of foods, like allergic reaction. That's called inflammation in my eyesight. And he gave me a list of foods to avoid, and they was most everything on that list was that foods I have to avoid. And I avoid those foods, and I'm getting better. You know, I have a lot of problems. My eyesight's getting better because I don't have those things that aggravate my intestines to stir up the inflammation in my eyes and stuff like that.
And think.
And I thought I would have a problem with sugar, but that wasn't a problem for me. It's just, following, the diet, and stuff like that. But I learned I have to do this, I want to very strict. Like juices was my downfall. I really like juices, but I learned to drink more water, and I feel better when I drink more water.
And in a nutshell, what are we doing for you? Can you recapitulate?
He's kind of balancing my whole system, giving me therapy for my internal organs.
Including
liver, kidneys, and
intestines. And what we're doing specifically is we're basically optimizing the health of your liver and kidneys, and we're doing dysbiosis therapy for the intestines.
Right.
And what dysbiosis therapy entails is basically taking natural medicines that eradicate germs, various germs in the intestinal tract, including bacteria, possibly yeasts and parasites, and we're replacing them with acidophilus. That's basically in a nutshell what dysbiosis therapy is. And for your liver and kidneys, you don't have liver and kidney disease, but they're definitely not functioning optimally. So all we're doing, we're just with natural medicines, we're optimizing the health of these organs. And that's really in a nutshell all we're doing. And with a few site-specific therapies, like there's a supplement that I've given you for your eyes, and that is supposed to be helpful for the eyes, nutritional supplementation for the eyes. But that by itself would not have improved your vision as much as it has so far. It's all the work we were doing for the internal organs. So anything else you want to say?
Well, I'm just continuing my therapy. When you do this, you have to be persistent with it. I probably like to read rules. It's hard, but I have to do it. Then I see results, so that keeps me more motivated. When you do something and you see results, you say, I got to keep doing it because this is really working. And that's what keeps me going. And I'm seeing results, and I'm happy with everything that's happening to me. And it took me a long time to get here. It took me 10 years to find this, so I'm going to run with it.
And just that brings up the one more question before we leave. You tried taking basically prednisone and autoimmune suppressive drugs, right?
Yes, and it was
for a long time. But you continue getting worse anyway.
Yeah.
Correct?
Yeah, it gave me more problems. I had the prednisone gave me cataracts, and then they gave me methotrexate, it was immune depressant, and I started with problems with my legs. And I had real severe pain in my legs. I got so one time I couldn't walk. I had to go to physical therapy twice. All these medical ingredients they gave me, it made my condition worse than what it was. I had 4 heart attacks.
You've had 4 heart attacks?
4 heart attacks. One not real bad, and it was just mild ones last year. I had 2 episodes of blood clots, but I heard could have been caused by the prednisone. They gave me high doses of prednisone for long periods of time. And the doctor told me it's not supposed to do that, but they did because they were trying to suppress my immune system. And it caused me to have bone loss, and I had to be careful if I walk, not to fall if my hip was, I could break a hip bone. And plus, I saw they did a scan on me for my, when your bone mass and stuff, but I could see where I have lost a lot of bone mass, over the years.
That's a scan.
Yeah, that's a scan. That's why I lost a lot of bone mass from taking the prednisone. So now I refuse to take it. Period.
So you're off of prednisone and methotrexate?
Yeah, I don't take those. I only take the prednisone in my eyes drops, and I had to take those because my vision was so bad I could lost my eyesight, and that was my last result. So.
And prior to seeing me, you tried other natural ways of treating sarcoidosis. You'd even seen other naturopaths. But what was, in a nutshell, what had other doctors done for you? Other naturopathic doctors?
Well, they just gave me a lot of supplements to take, a lot of vitamins and herbs and things like that.
What were those herbs supposed to do? Do you know?
For they gave me some for like circulation, like
help circulation.
Help circulation for my legs to get rid of the swelling. Gave me omega-3s for my blood and for the sarcoidosis. A lot of vitamins.
Vitamins, minerals fatty acids, essential
Yeah,
fatty
fatty
acids,
acids, yeah.
and then some herbs to help with your circulation.
Circulation.
And then maybe did they give you some anti-inflammatory herbs too?
Yeah, cumin and turmeric and stuff like that. Turmeric and something else. Bonzwella, arthritis hormone.
Curcumin and boswellia.
Yeah, all those,
yeah. Those are mostly anti-inflammatory herbs.
Yeah, gave me a lot of those. But I took them and I didn't feel anything, you know.
No improvement.
No improvement.
Did any of them ever give you anything to help optimize the health of the internal organs, including liver, kidneys, intestines?
No, they didn't.
That's the problem. That's the problem.
And
that is the key. The root cause of autoimmune disease is dysbiosis, meaning an imbalance in the intestinal tract. And to help with that, first you need to drain or detoxify or cleanse, optimize the health of your liver and kidneys, followed by dysbiosis therapy. It has to be in that order. If you do dysbiosis therapy first, meaning if you get rid of those germs inside this intestinal tract, and then do liver and kidney, you can get sick. So initially you drain, that's the appropriate word, the liver and kidneys, which means drainage is detoxification plus optimization of those internal organs, not just detox. We're not talking just detox. It's optimization of those internal organs so the liver and kidneys work better. You do that for at least a month or so, and then you do dysbiosis therapy, which is exactly what we've done for you, right?
Right.
And then we're continuing to do that, and that's exactly what's been missing in your protocol. And so I'm sorry to see that you've gone through all these years and not gotten appropriate treatment. But I'm so glad to see that in 3 months you've improved so much. Thank you so very much, Carolyn, for your time. Thank you so much. You're welcome.